our eyes upon Jesus. So we can sing together, the words will be projected. Turn your eyes upon Jesus. Oh, so are you weary and troubled? No light in the darkness you see. There's life for a look at the Savior, and life more abundant and free. Turn your eyes upon Jesus, look full in His wonderful face, and the things of earth will grow strangely dim in the light of His glory and grace. Through that into life everlasting, He passed and they follow Him there. Obras sin no more than dominion, for more than conquerors we are. Turn your eyes upon Jesus, look full in His wonderful face, and the things of earth grow strangely dim in the light of His glory and grace. His word shall not fail you, He promised. Believe Him and all will be well. Then go to a world that is dying, His perfect salvation to tell. Turn your eyes upon Jesus, look full in His wonderful face, and the things of earth will grow strangely dim in the light of His glory and grace. Amen.
Amen.
Thank you. What a lovely way to start. All right, so I'm Dr. Mark, and so I'm going to read through what I need to say for the bio because my memory can't remember. But we're really, really happy that Mark was able to be here today and this weekend actually, and Clyde gave you the details of what we've got happening. I'll make sure it's up on the notice board so you can go and check it as well. And if you want to book in for one of the counselling sessions, come and see me, and I'll make sure that happens for you. It is going to be a bit of a case in first serve, just so you know. All right, so Mark Sandoval is a doctor, and he's board certified in emergency medicine and lifestyle medicine. He served as the founder and chairman of Health by the Book, president and medical director of Uchi Pines Institute, health ministries director of the Gulf States Conference, and he currently serves as the founder and president of New Paradigm Ministries, providing counselling, health consultations and seminars to those in need. He has a passion for God and seeks to serve Him in everything that he does. He particularly enjoys sharing about the gospel and its impact upon healing, spiritually, emotionally, and physically. He also enjoys home life with his wife and 6 children. And I just wanted to let you know that just before Dr. Mark comes up, that we know that some of the topics tonight or this weekend that you hear can address some sensitive areas in personal health and lifestyle. So that is why Mark is doing the counselling, because it's an important thing for us, if we need to go and talk to Mark. If it's a bit hard to get to Mark, there's also the leaders in this church who are really happy to discuss or talk with you as well if you need some help, some prayer, or other consultations that we can try and organise for you. So thank you very much, and we're really happy that Mark could be with us tonight. Thanks, Mark.
All right. There we go. Test, test, test. Excellent. Good evening. Good evening. It's a pleasure to be here with you and to be in this part of New Zealand. This is my second time to New Zealand. The first time was in October of 24. And I get to be here again and meet some friends again. And very happy to be here and to be a part of your journey, and you get to be a part of my journey, and our journeys get to intersect at this time. And I love those intersections of journeys, because then I get to meet more of the family and get to, enjoy more people and listen to more stories and help more people towards freedom, because that's what I like to do, is help people to freedom. A little bit more about my background. Again, I'm, as Kim read and as she mentioned, my background is medicine. I'm a medical doctor, and I did studies at Loma Linda University in California, and then I did emergency medicine training in Michigan. And then I worked in Michigan for a while, and then I was director of emergency medicine and family practice at a community hospital in Trinidad, a little island of Trinidad and Tobago. And then I came back to the States, and for about a decade, I worked at a lifestyle center and helping individuals get off their medications, reverse their diseases, apply lifestyle and natural remedies to their condition and help them, to generally improve. And while I was there at the Lifestyle Center, I came to recognize more and more that what an individual thinks and their attitudes and so on has a significant impact upon their health behaviors, and their health outcomes as well. And so I became more and more interested from that standpoint, and so I spent more and more time counseling with individuals. And eventually I realized that, I needed to focus on a ministry that would really focus on the mind and the issues of the mind, and helping individuals to find freedom from that standpoint. So getting close to 4.5 years ago, we started our current ministry, which is New Paradigm Ministries, and it really is a new paradigm. So we're going to kind of dive into that this evening with, the topic of getting to the cause or getting to the foundations of, the major diseases that we struggle with. And instead of this being a lecture, if it was a lecture, then I would have the PowerPoint out and we're going to, and I'm just going to run through that. But I've got the whiteboard, and the whiteboard means that we can interact, right? And so we can take a journey together rather than you coming along on my journey. And so that we can do this collectively. So when it comes to disease, right, then we have the question, what is the cause? Right? What is the cause? And can we even come to a cause? Right? When we think about disease, let's just take heart disease, because it's still the leading killer of individuals around the world is cardiovascular disease. Cancer is coming up quickly, and it won't be too long before cancer overtakes heart disease as the number one killer. But heart disease is still the number one killer. So in relation to heart disease, tell me what you think in regards to a cause. All right, lifestyle. Blood pressure, okay. What's that? Diet. Exercise. Cholesterol. Okay. Stress. Yes. Bad sleep. Okay. Yeah.
Genetics.
All right. Genetics. All right. All right, so we've got genes, sleep, diet, a larger category of lifestyle, cholesterol. All right, and stress, you said. Right. What else did you say? What was that? Oh, yeah, blood pressure. So it's good that you have it. If you didn't have it, well, we wouldn't be having a discussion right now. But maybe if we put high blood pressure, right? Woohoo. And so on. All right. So let's look at these different factors and ask ourselves a few questions. All right. So we have genes at the front, at the top. All right. So in relation to genes, when did you get the genes that you got? Okay. So you had a single cell, and it has a nucleus, and there's this little thingy, right? And so on. And now you have the union of the two, and now you have you as a cell, right? And all of the genes that you're going to have, you have when you're a single cell. And then from that one cell, it divides, and then you have two cells, and then it divides, and you have more and more and more, and so on. And so every cell in the body is going to have how many of the genes from the original cell? All of them, right? So it's going to take all of them, and it's just going to copy them and move them on from cell to cell to cell, right? But you have many, many different types of cells, and the only way that you can have different types of cells if you have the same information is they must select from the information, right? So that this type of cell selects these parts of the blueprint, and because it selects these parts of the blueprint, now it has this shape and this function and so on. That type of cell over here selects other parts of the blueprint, and so it has another shape and another function and so on and so forth. Now, not only are there genes, but you have probably heard of the epigenome. And the epi means on top of, so you have the epigenome, and the epigenome is not the letters of the information in the DNA. What it is molecules that attach to the DNA molecule and then cause parts of the DNA molecule to be open and expressed so that you can use it, and other parts of the DNA to be closed off so that you can't use it. So you could potentially have a dysfunctional gene that's there and present, but you don't see it until that part of the genome opens up, and now you can start using that part of the genome, and then you start seeing the problem associated with it, right? If it does that, the question is, what causes it to open up? Or what causes it to close back, right? If you can turn it on, you should be able to turn it off, right? So it's got an on switch, it should have an off switch. And as far as the code is concerned on the DNA, it's relatively stable. Of course, we understand about, mutations and so on. And by the way, mutations are not beneficial. The more mutations you add to the system, the more dysfunction that system has, right? All right, so there are genes. How often are genes the driving factor when it comes to heart disease? Maybe about 1%. Maybe about somewhere around there, right? Do genes have a factor? Yes, they do have a factor, sure. And does that mean that all of the rest of it doesn't involve the genes? No, that's not what I'm saying. What I'm saying is that simply the sentence structure of the information, the DNA molecule that you got, has the problem, and it's passing the problem on directly, right? And it is the primary reason why an individual then has the dysfunction with their cardiovascular disease. That would be about around 1%. Now, much of the manifestation of disease is through the genes. It is. But it's not necessarily through the ABCs and so on of the letters that are in the DNA molecule. It's in this epigenome, and the modifying of the structure of the DNA with its on switches and its off switches, right? Turning on particular genes and turning off particular genes, and so on. That happens throughout a lifetime. And that is influenced by a lot of different things, including some of the ones that we would look at here, like sleep. Diet is a major factor. Right? Of the physical factors, the largest physical factor that has an impact on the epigenome and the availability of genes to be used in making new cells and so on and so forth, or new products for the cells, diet is the number one factor physically. Do you know what's the number one non-physical factor? Okay, so stress is going to be a component of that. Okay, it's going to be a component of that. So what is stress a component of? Okay, so your thoughts, it's a thought process. So stress is the result of thinking about things a particular way or perceiving them as a particular way. And indeed, the strongest impact upon the epigenome and gene function is going to be through the thoughts, right? The attitude and so on and so forth. It has a strong impact from that standpoint. But diet definitely has an impact. Lifestyle and so on and so forth has an impact. Now, if you have a gene mutation that comes in from inheritance, comes from father, comes from mother, you get it when you have one cell, is that something that you can necessarily fix? Not so much, right? Now, it's possible that if it's not a gene that you need to use all the time, that it might not manifest itself very strongly. But if it's a gene that you have to use all of the time, it can be a problem. But if it's inheritance, it comes from the time you have one cell, and you're going to see the dysfunction either in childhood or it will manifest during puberty, mostly in childhood, right? And there's not much that you can do about a truly genetic cause. You just kind of, you got it. I say that, and yet there is some evidence out there that even thoughts or attitudes can have some impact on the DNA and the repair of the DNA. So that's an interesting thought as well. All right, sleep. All right, how many, when you can't sleep, it's because you don't want to sleep? No? No? Okay, so when you're not sleeping, why is it that you're not sleeping? Yes, it's usually, it's not always, but it's usually because you have so much on your mind that you're trying to figure out, that you're trying to work out, that you're trying to fix, that you're trying to, that you can't turn the mind off, and the mind is just running laps around you while you're laying in bed, and you're going, oh, please stop it, I just want to go to sleep, and it's just running all over the place, and it has to figure out every problem and every part of every problem and put it all together and figure out how to all fix it before you can go to sleep, and then wake up in the morning and write down the formula of how the world is going to be fixed. Right? And indeed, if you could just get yourself to calm down and not pay attention to what you're thinking about, then you go to sleep. Right? All right, diet. Is diet an important factor? Yes, absolutely. And there's a lot of research out there in regards to diet and how beneficial and helpful diet is in many, many different areas of your life. Diet clearly is a major factor when it comes to many different diseases, disease processes, health and recovery of health, and so on and so forth. In my experience of having worked in a lifestyle center for a decade, and also being a board member for a number of other lifestyle centers, and then having the opportunity of traveling around and visiting with other leaders of other lifestyle centers as well, I don't know of a lifestyle center that is reversing disease that includes animal products in the diet. Right? I don't know of a lifestyle center that is including animal products in the diet that is also reversing disease. Right? So it appears, and there's a lot of debate. All right. When we talk about science, oftentimes what we talk about is the literature, right? Or scientific studies, right? So when we talk about science, oftentimes we're talking about the scientific literature or scientific studies and so on. And of course, like in medicine, you have to learn statistics, and then you have to learn biostatistics, and you have to learn how to understand what are the different studies that are done, how are the studies structured, what kind of questions can they actually answer, because sometimes you can structure a study in such a way that you end up answering the question without actually doing the right study to answer the question, and so on. And anyway, so what I have come to realize is that scientific literature is a language. It's a language, right? And if you have learned, if you've studied in medicine, if you studied in biostatistics, if you've studied in allied health professions and other things like that, you learn the language of scientific literature. Now, what can you do with language? Just any language. What can you do with language? So hopefully it's to communicate, right? Now, what can you communicate with others? Okay, information. Very good. So we're going to communicate information, and that information is going to fit into one of two categories. It is either truth or error, right? Truth or error. So, one of the factors of truth is that it doesn't contradict itself, right? It is internally consistent, right? So truth is internally consistent. It doesn't contradict itself. Does the scientific literature contradict itself? All the time. All the time. Because you will have a conference, like for instance, if we just take diet as an example, I belong to the American College of Lifestyle Medicine. So when you go to the ACLM National Convention every year, everybody is gung-ho about plant-based diets and, and so on and so forth, and literature and the research associated with it and whatnot. But you can go to, and there's thousands of physicians and other healthcare providers that are there, and they're all excited about it. But you can go to as large conventions on keto diets, and you can go to as large conventions on, whatever, and you can find all sorts of varieties of it, and everybody has research, right? Everybody's got research. And so this research contradicts that research, which contradicts that research, and so on. But you can find a lot of research that then, this one complements this one complements that one, and so on. And so you know that there has to be error there, because not only can language communicate truth, but language can communicate error. And the scientific language does both, right? It communicates truth and it communicates error. And so that means that you need to be able to decipher. You need to be able to read it, differentiate, but you have to have a standard that you use in order to differentiate or to evaluate and say, okay, does it fit or does it not fit? Right? And it's important for that. We used to have, in my training, we used to have, literature reviews with the attending physicians and so on, so that we, as students and trainees, would learn how to read the scientific literature to determine whether the outcomes that they said were actually viable or not viable. And do you think they knew perfectly? No. So from a dietary standpoint, all right, well, science will tell you most anything. But one of the things that diet talks about is cholesterol when it comes to heart disease. All right. So cholesterol, where do you find it? All right, so you find cholesterol in animal products, right? So cholesterol is an integral, absolutely necessary component of cells in animals, right? So whether that's humans or elephants or snakes or any kind of animal creature, animal cells must have cholesterol in it. Because we move, right, our cells need to be movie as well, right? They need to be able to be deformed and take a different shape and stretch a little bit and compress and so on. And the cholesterol is an integral component in the cell membrane so that the cell can do that. And it's not like a tree where you bend it and it goes... Our bones are kind of like that, but the rest of us are a little bit more wiggly, And cholesterol helps it to be wiggly like that. And cholesterol is also necessary for vitamin D. You need cholesterol to make vitamin D. You need cholesterol to make estrogen and testosterone and so on. You need cholesterol for brain function, and it helps with nerve transmission and so on. It's really important. If you don't have cholesterol, you're dead. So cholesterol is not necessarily a problem, but when is it the problem? When it's too high, right? Or when it's too low. Can you have too low cholesterol? Yes, you can. And especially in children that have too low cholesterol, they have developmental disabilities. They have mental health challenges, right? They have a mental retardation because they don't have enough cholesterol for brain function and so on. And if you drive your cholesterol levels too low, well, there was that topic about, what was that other topic for this evening? I think it was like dementia. Oh yeah. It could be a problem, right? But having it too high is definitely a problem. Now, when it comes to heart disease, we usually think of cholesterol being in like the artery of like the heart, right? So let's say that this is the heart muscle, right? And you have this artery that's going through it, and this is going to be supplying blood to the muscle of the heart. And what happens? Well, you have this little thing, and then it kind of grows over time, and it gets bigger, and it gets bigger, and it gets bigger, and now you only have a little bit of blood that can get through, right? And since the blood is flowing in this direction, if it gets blocked off, then everything down here is going to die if it's blocked off long enough, right? And of course, along here you have some cholesterol, and along here you've got a little cholesterol, but here you got this big old plaque, right? So my question is, what's the cause of that? Right? What's the cause of that? And you might say cholesterol, but then my question is, well, how much cholesterol was here versus how much cholesterol was here versus how much cholesterol was here in the artery? Yeah, the same. All right, it's the same. So if you have the same amount of cholesterol that's here, here, and here with a flow that's going around, why do you have a big mountain of it right here? Right? So what is it that's special about that point that now you have a plaque in that part of the artery? Right? Okay, something made it stick. All right? Yes? So in reality, what's happening is you have little white blood cells that are going through the bloodstream, and those little white blood cells, when your cholesterol levels are higher than they should be, they go around and they collect extra cholesterol, and now they have this payload of extra cholesterol, and they're going along, and now there's a signal. There's a signal that's here. And while they're going along, they go, oh, signal. Huh. And so they grab onto the edge of the artery wall, and they go out into the artery wall, and they start moving around to figure out where the concentration of that signal is. And some of them will die there, and guess what stays behind? The cholesterol, right? And then as long as the signal remains, more of them are going to come along, and they go investigate what's going on, and they kind of, some of them will die there, and they leave the cholesterol behind, and so on, and this process just continues to grow and grow and grow and grow and grow over time. So what's the signal? What's that? Okay, injury, yes, that is the usual explanation for this, is that what you have is you have a system where there is some flow dynamics, right? So there's an irregularity somewhere in the wall of the artery, and with that irregularity, we were just watching some nature, nature pictures and so on up here before the program began, and you have a river that's going along, or you have a waterfall that comes, or it goes around a rock and so on, and you get this kind of swirling type of stuff that's going on. And so with these irregularities, then you end up, this is the theory, that you end up with trauma to the wall of the artery, and because of trauma, there's inflammation, and the inflammation from the trauma is the signal that the white blood cells are responding to in developing the plaque. Right? So that's the theory. My question is this: have you ever cut yourself? How long did you bleed for? Yeah, a short while. Because if you cut yourself a few weeks ago and you're still bleeding, you're probably not here. All right? How fast do blood vessels heal? I mean, is it important that they heal slowly or they heal quickly? Yeah, it's important for them to heal quickly. And of course, the healing, it's not that they necessarily heal really quickly. They need to clot quickly. And now they go through the healing process so that you don't bleed out, right? But it's a relatively rapid process where you recover from that injury to the artery. And you can cut the whole thing in half, and you can have healing that happens within a matter of weeks or so. This process, we're talking years to decades. Why doesn't it heal for years to decades? Okay. So what else could possibly be in this spot that could be the cause of a signal that then can be picked up by the white blood cells and that can result in the development of a plaque over years to decades? Okay, so if it's fragile, then the body is sending a signal. How do you send signals? Yes. Okay, what's the controller of the body? Yeah, that's the brain, right? So all of the control mechanisms are going to be centered up here. I'm not saying that all of the control mechanisms are in the brain. There are secondary control mechanisms in the body and so on and so forth, but the primary controller of the functions of the body are up here in the mind, right? And much of that control is going to be in like your hypothalamus, brainstem, and so on. These you're not conscious of. They're unconscious things. It's not like people are walking around and going, oh, well, what's my blood pressure? Oh, yeah, I'm at this right now. I need to bring it up a little bit. Oh, no, I need to bring it down a little bit, and so on. We're doing that with our mind all the time. It's just unconscious, right? And, of course, the mind is controlling, like, electrolyte levels and fluid levels in the bloodstream and all of these different things, right? So guess what goes right there to that wall of the artery? A nerve, right? So there's a nerve ending that goes right there, right? And that nerve ending on the other end is connected to a spot in the brain where if you have an electrical impulse that generates in that spot in the brain, it ends up in that spot in the body. And if it's the same type of impulse and it's repetitive and something that happens over years or decades, so in other words, it's something that is habitual, then it can have an impact in the same part of the body over time, and you can have the development of plaque and so on and so forth developing, and eventually, right? I know, graphic. That's not graphic. I've worked in the emergency department. There are other things that are much more graphic. But it's traumatic, it is. Did you know that an individual who is more angry is more prone to die from heart disease? That anger accelerates the process? Oh, that's interesting. Yeah. And where does anger, anger has not only its manifestation in specific locations in the body, but anger has its manifestation also through then the adrenal glands and the release of epinephrine, norepinephrine, cortisol, and so on, and those stress hormones going throughout the body and then changing the physiology of the body. Now, the mind is quite remarkable because with a single thought, you can change all of your physiology within seconds. Right? You can change all of your physiology within seconds. So let's imagine that, it's getting darker outside and this meeting goes a little bit later and so it's really dark outside and you get to walk home. Now, I know some of you are a bit farther away, just like I am, but just imagine that you get to walk home, and you get to walk home through some unfamiliar sections of the city and so on while you're going, and you're not sure who's there, you're not sure who the neighbors are, you're not sure whatever the situation is, and while you're walking along, you hear a few and then you look and you see, and there's this huge dog coming at you with these big teeth, and it looks like it's slobbery and all that kind of stuff, and it's intent right at you. And I'm talking big dog. Well, it won't take but a few seconds for you to double your blood pressure. You can double your blood pressure in 5 seconds, just with a single thought, right? Your pupils are going to dilate. Your blood vessels are going to constrict in your skin, but they're going to dilate in your muscles and in your brain. You're going to start dumping glycogen, well, you're going to break down glycogen and dump glucose into your bloodstream, so you've got blood sugar to be able to work with, and so on. So your blood sugar levels are going to go up, right? Your heart rate is going to go up, and all sorts of physiology changes throughout your body, boom, with a single thought. Right? So you can change all of your physiology with a single thought, but you can also have an effect in one spot in the body by a repetitive thought again and again and again and again and again and so on. And it doesn't just have to be in the heart, it can be anywhere. Right? People have gout, and oftentimes gout is in the first metatarsal phalangeal joint, so it's at the joint between the big toe and the foot. It's usually where it starts developing. And we know that gout is associated with what chemical? Yes, uric acid, right? So I'm waiting for my healthcare providers here. So yes, uric acid. So gout is associated with uric acid. And what happens is when uric acid becomes super concentrated, it crystallizes. So it turns into a crystal. Have you ever made rock candy? Ever done that in your past? Yeah, rock candy. So what you do, this is an experiment. You can go home and you can do it, right? So what you do is you get a cup and you put water in it and you fill it most of the way, and then you heat it up so that it's pretty hot, and then you put sugar in it, and you mix it in, and you put some more sugar in it, and you mix it in, and you put some more sugar, and then you mix it in until you get to the point where it won't mix in anymore, right? You get a little bit that's still kind of, that's down at the bottom of the cup. Okay, now you get a piece of string or yarn or something like that, tie it to like a toothpick or a straw, and that's over the top of the cup, and then you hang that string down in the water, or that yarn down in the water, and then you leave it. And you come back later, and guess what? There's all these crystals, all these little clear rocks all over that string, right? Because what happens is you have this water that's hot, and now it starts cooling down. And when it starts cooling down, your sugar that's in that concentration super concentrates, and now it starts crystallizing back out a solution. And that string has a bunch of little projections that are coming off of it, and it's a perfect place for that crystallization to begin. And then you end up with rock candy. It's basically big crystals of sugar. Tastes wonderful. Not good for your diabetes. Right? So, uric acid, when it becomes super concentrated, it makes crystals also. But its crystals look like needles. Spiky, pointy, very projectile, like a spear. And those, when they're inside of a joint, poke, 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 painful, red, swelling, pain, it's miserable. It's absolutely miserable, right? And I don't dare draw this because I'm such horrible at drawing. I can do I can do lines like that. But once I try to do something recognizable, then people realize my drawing skills, which are not much of anything. Oh, there's the big toe. And there it is, right? It is hot, it is painful, it is, it's just, And let's say that is the right, oh, no, that is my left foot. All right, never mind. I looked at it and I went, oh no, that's the left foot. All right, so that's my left foot, right? How much uric acid? So in the emergency department, sometimes you have patients that come in and they'll have gout in their left foot, sometimes they have gout in their right foot, sometimes they have gout in both feet, sometimes they have gout in other joints as well. Interestingly enough, the individual that I took care of that had the worst case of gout, his uric acid levels were low. And it threw me off for a while because I thought, well, it can't be gout because the uric acid levels are low. No, it ended up being gout. And the uric acid levels were low. I've had other patients that had really high uric acid levels. They've never had gout in their life. But how much uric acid goes to the left foot versus the right foot? Yeah, the same amount. But the problem can show up in the left foot and not the right foot. Why? Yeah, it is a good question. I asked it. Some people say, well, the farther you get away from the heart. Well, no, there's another joint after it. That's even farther, and you don't usually get gout in that joint. People say, okay, well, it's usually cold, right? It's susceptible to cold, so the more cold that it is. Okay, well, why is your left foot colder than your right foot? Right? There's got to be some reason for that, and it's not the uric acid. It's not the uric acid. If you go walking down the beach, and yes, that's supposed to be a beach, and sorry, that's a really horrible sandcastle. If you go walking down the beach and you see a sandcastle on the beach, what do you conclude? Either the 3-year-old or Dr. Mark made that sandcastle, right? So somebody used the sand to make the sandcastle, right? And so, all right, the uric acid is the sand. Can you have gout without uric acid? No, you can't. But is it the uric acid that makes the gout? Or does something use the uric acid in order to make the gout? Right? So the sand doesn't make the sandcastle, but you can't make a sandcastle without the sand. You got to have the sand to make it. So yes, you can't have gout without having the uric acid, but it's not the uric acid that makes the gout. Something must use the uric acid, something must concentrate the uric acid so that now it becomes super concentrated and now you have gout in the toe. What can concentrate chemicals in the body? Okay, a weak spot? No, not so much. What's that? Dehydration? Okay, well, in general, yes. If you dehydrated, then you would super concentrate the liquid. So you know the water's out, but if the uric acid doesn't go with the water, then you have higher concentration of uric acid. Yes, but you would see that everywhere if it was just a natural process like that standpoint. Why that toe? Okay, circulation. Okay, so you have signals from the brain, but they have to go to somewhere. There are living cells that line that joint, right? So you have cartilage that's, on the ends of bones that are in joints and so on, and then that cartilage you have chondrocytes and you have some other connective tissue cells that are around that as well, and so on. It's only a living cell that can concentrate a chemical in the body somewhere. It's only a living cell. Because living cells, they have a cell membrane, a phospholipid bilayer. And that cell membrane, not everything can just get into it. You have to have transport molecules, right? That can bring certain things in, or that can put certain things out. And the cell will use ATP, an energy molecule, to do active processes against a concentration gradient. And in order for you to concentrate uric acid on that toe, you have to be able to push it against its concentration gradient. You've got to go from downstream upstream. So that means you've got to put power into it in order to move it against its normal diffusion flow, in order for it to super concentrate, and now for you to have gout in that toe. And it can only happen by living cells. So then, of course, the question is, what is it that will cause the cells to do that? Yeah, because it's the upper inner portion of the right brain that is connected with the toe, and you can have a signal that's coming from up here, and that's going down there, and now, in response to that signal, the cells are taking the uric acid that already exists, and so on, and now it's putting it into the joint space, and in the joint space, it finally super concentrates, and now it crystallizes, and now there's the pain and the inflammation, and so on and so forth. Are chemicals involved? Yes, absolutely. And if I give you a medication to decrease your uric acid level, then once it gets low enough, that gout goes away, because now the uric acid is not super concentrated, right? And now it'll go away, and we fix the problem, right? No, all we did was pour water on that sandcastle, and we made the sandcastle go away, but we didn't do anything about the sandcastle builder, right? So it's important for us to do something about the sandcastle builder. And what's the sandcastle builder? Right, yeah, it's that thing. Cholesterol. All right, we talked about it. It comes from, animal products, animal cells, and so on and so forth. How do you increase cholesterol in a system? Yeah, eating it, right? That would be one way, right? One way is eating it. So clearly, if you eat animal products, then you're going to take cholesterol, and then you're going to increase the cholesterol concentration that you might have. Is eating something where you tripped, fell, poof, No? You didn't just eat that cholesterol on accident? No. Okay, what does it involve? Choice, right. There's choice, right? So when you're talking about choice, what are you talking about? You're talking about the mind, right? Does anybody have a lifestyle without having a reason for the lifestyle? Do you eat what you eat for a reason? Do you drink what you drink for a reason? Do you exercise when you exercise for a reason? Do you get sun when you get sun for a reason? Yeah, there's always a reason behind what you do. You might not be aware of the reason yet, and if you start thinking back on it, and somebody asks you a few questions and so on, you can kind of dig back and you can go, okay, well, yeah, this is the reason why I was doing that, and so there's always a reason for what you do. Where do you find the reason? Yeah, up here, okay. So lifestyle is an effect of the mind, right? And its processes, right? Its function. Diet is an effect of the mind, right? Sleep is an effect of the mind. I'm not saying genes are. Cholesterol, how much dietary intake I get is an effect of the mind. But guess what? The cholesterol that you consume it's anywhere between about 25% and 75% that gets absorbed. So what controls between 25% and 75%? Oh, all right. No, that's its processing, right? And the liver is the big processor of, or producer of cholesterol, or user of cholesterol, because bile is made from cholesterol. And so those bile salts, or those bile acids, come from cholesterol, and so the liver needs to use cholesterol in order to make that, in order to help break down the fats, so that you can then digest the fats and then absorb them and then be able to benefit from them. And so the liver is big when it comes to cholesterol, but the liver doesn't do the absorption. It's your digestive tract that does the absorption. Now, what is it that can control the digestive tract to modify how much of the cholesterol can be absorbed or not? I'm going to turn my hair purple, green. Yeah, the mind can do that, for sure. Right? It's the master controller. If there's any ability to upregulate and downregulate the absorption of various different chemicals in the body, ultimately the mind's going to have its fingers in it somehow. It might not be direct, but it can be something that's indirect as well in relation to that. Right? Blood pressure, high blood pressure. There's a lot of factors in relation to high blood pressure. A lot of them has to do with kidney function, has to do with heart function, has to do with arterial function, has to do with fluid levels and electrolyte levels, and so on. It has to do with the release of antidiuretic hormone versus vasopressin, and I mean that is, and so on. So there's hormones involved. There are organs involved, and all of that kind of stuff in the regulation of blood pressure. What controls it all? Yeah, ultimately it's controlled through here, right? Ultimately. And not saying that that's the only thing, but that's the ultimate controller. We had a woman at our lifestyle center, and she came, her blood pressures were just really scary high. She was on all sorts of medication. They were trying to figure out how to get her under control. She came to us. We weren't taking her off her medication because it was already really high on the medication. We were just trying to add, some natural remedies, lifestyle interventions, and so on top of it in order to help her out with her situation. And we had to send her to the ICU. Well, we had to send her to the hospital. They admitted her to the ICU. She was in the ICU for a week on intravenous and oral and so on. For a week it took them to get her blood pressure under control. And then even in the hospital, it was not controlled very well when she was on the step-down unit, and then before she was discharged, and then she came back to us. And so her blood pressures were still not as high as what they were before, but they were quite high and not comfortably high. I mean, uncomfortably high. And one of our staff told her, they said, "Oh, you know what your name means? Your name means that you are loved by God. Your name means that you are loved by God." And she said, "Really? Do you think God loves me?" I said, "Yes, of course." Right? That's what your name means, that he loves you. She took it. And guess what? Yes. Within minutes of that, her blood pressure was about half of what it was before. We were all looking at each other going, wow. Wow. I mean, yeah, we understood that the mind is powerful and it has a powerful effect on the body, but I mean, really? That powerful? Yes, absolutely. It is, right? It really is. All right. So Michelle came to me. Michelle was, I always tell her story because it was like the story that was like the aha moment for me in my clinical practice. She came, she had stage 3C ovarian cancer, and she had been an athlete. She was actually, was she an Olympian? I think she was. I think she was an Olympian at some point, and then she became a coach later on in life and so on. So she was very, she was very fit, she was very active, but she came to us after developing the ovarian cancer, and she went through two rounds of chemotherapy. And with each round, the tumors were more in number and larger in size, and so it clearly wasn't working. And so the team suggested that she undergo an experimental regimen of chemotherapeutic agents to see if it might benefit her, and she had had enough. And so she said, no, I'm not interested. And so she went looking online, she found the lifestyle center, she came to us, I was her doctor. And so we did what we did. We did a plant-based diet, right? We did exercise, it's called walking, right? We had her outdoors more than she normally was, and so then you get sunshine and fresh air, right? And we had her drinking lots of water, which is a nice thing. And, we added some other things in there like hydrotherapy. One of the things that we did is we boiled her. Yes, she got to be a boiled egg for a little while. There's some research that shows that a significant amount of cancer remissions that have been documented in scientific literature were associated with a fever state. So whether an individual had an infection and developed a fever and then the cancer started going away, or they had like a post-surgical or a surgical related temperature elevation, or whether they had a sauna exposure or other things of this nature, there's quite a bit of evidence from that standpoint. And so a number of centers, especially in Europe, have been studying this and looking at hyperthermia treatments to induce a fever in an individual that has cancer and to see how that might benefit them. And there's some interesting results. It increases the presence of natural killer cells and cytotoxic T cells inside of the solid tumors. It disrupts angiogenesis, which is the blood vessel growth that supports the cancer. It increases cellular apoptosis, or the cell death of the cancer cells. It stimulates your heat shock proteins, and recently science has discovered that the heat shock proteins are actually associated with immune function. And so with heat shock protein stimulation, especially HSP71, it has an impact on immune system function, and so it might prevent the cancer from hiding, and so on. There's a lot of factors associated with it, but anyways, we would boil her about once a day. People don't like getting boiled, but it can be helpful. And then we gave her some other natural remedies and things like that. And she came to us, her CA-125, which is your cancer marker for ovarian cancer, the blood marker, it was elevated. And she was feeling miserable, and she didn't feel like even walking, and so on. So we did this with her. But by that point, I also understood that the mind has an impact on an individual's healing. So I talked with her about her life and what had gone on and so on. And the story came out. And the story was that she never knew her father. She never met him. He left shortly after he and her mother were together, and then he was gone and in another country. And I don't even know if she knew his name. But she had never met him. But the real issue was her mother, because her mother was a party girl and into drugs and alcohol and men and so on, and having a little one was kind of a drag on her life. And so when she was around 8 years old, the mother was like, this is enough. Mom took her to be with grandparents. and dropped her off with the grandparents so that mom could be untangled from an 8-year-old, and which was a good thing for Michelle because now Michelle had a stable environment to be in. But now Michelle started calling grandmother mother, and she called grandfather father, and now she had these parents that she was working with, and then this other woman would come into the picture, her real mom, her biological mother, would come into the picture and now be jealous of the relationship that she has with her grandparents, and now try to break up that relationship and do all sorts of chaos and whatever. And so, needless to say, she was not happy with her mother. Not happy with her mother. And so she had a little bit of resentment and bitterness towards her mother and so on. And I knew that wasn't going to be helpful. So we talked about how she could be free from that resentment, and that bitterness and so on, and how she could go about doing that. And so, what does she do? Well, she wants to get better, so she eats a plant-based diet, and she goes out walking, and she's out in the sunshine, and she's drinking water, and she's doing the hydrotherapy and all that kind of stuff. And she's also working on the resentment and bitterness and so on. The session is over, and the sessions are 17 days. Session's over, her cancer marker's down into the normal range. She can go about 3 to 4 kilometers, walking, jogging, and so on. She's getting so much strength back. She's happy. 2 months later, she has a repeat scan, and she had 11 tumors in the abdominal cavity, and now she only has 5. So clearly things are working, right? So she's got 5 tumors instead of 11, and the 5 that remain are smaller than what they had been previously. 2 months after that, so now she's 4 months out. What's up? Her cancer marker's back up. Oh, okay. So what's going on? She's still on the plant-based diet. She's still walking. She's still outdoors in the sunshine, fresh air. She's still drinking the water. She's still doing the hydrotherapy treatments now herself at home and all this kind of stuff. She's still on the plan. But Mom came back. Mom visited. And Mom visited, and Mom is how Mom is, and Michelle is how Michelle is, and Michelle did the Michelle thing with Mom, and Mom did the Mom thing with Michelle, and it did not go well. And now she's back in the resentment and the bitterness and all that kind of stuff, and so her cancer marker is back up. So I talked with her, I counseled with her again. We talked about how she can be free from that resentment and the bitterness and, and so on. She's like, oh yeah, that's right, I forgot about that. And so she started working on those things again, and the next call, cancer markers are back down in the normal range. So for her, that was my clinical case where I had I had a patient and I followed their clinical case, and I was like, all right, this is clearly mind-related. Because the other factors were staying essentially the same. It was the relationship stuff that was kind of going, and that was being problematic in that case. How many times is relationship stuff involved in disease? Is it possible that there is a dis-ease in the mind in relation to relationships, and eventually that dis-ease, through the control of the mind on the body, ends up as disease? I tell you, now that I've been asking lots of questions, and I see this stuff, and I counsel with a lot of individuals, and so on. I see the pattern over and over and over and over and over again. Right? I see it over and over again. All right. So, if that's the case, then so, what is it that the mind needs? What does the mind need in order to function well? Peace. Sleep. What? Happy children. Yes, be happy. Right. Okay. So I'll go down here. All right, so what are the body's needs? Okay. Nutrition, yeah, what else? Water. Yeah, what else? What's that? Oh. Okay, shelter. I'm going to put in there temperature or warmth, right? Because that's really what shelter is about, temperature regulation, sort of. You said sleep. I'm going to put it this way, rest. Okay, oxygen. All right, that's important. Okay. Okay, yeah, so exercise or activity, you got to be able to do something with it. What about the mind? Security. And somebody said peace, right? I heard somebody else, they said love, right? We were down here, but I heard you say love. What else? Hope. Did I hear that? Hope. Justice. Stimulation. Okay, yeah. Okay, mercy. All right, so we got a good list here, and we can go on. I mean, there's lots of stuff. All right, there's lots of stuff. So the body feeds on nutrition, the body feeds on water, the body feeds on oxygen, the body feeds on these different things, and I'm going to put this in the terms of chemicals, right? So the body feeds on chemicals. Right? What does the mind feed on? What's its food? Information. The food of the mind is information. Right? Now, if you're a Bible reader, man does not live by bread alone, but by every word that proceeds from the mouth of God. Right? And the word is now information. Right? So the mind feeds on information. What kind of information does the mind need? Does it need truth or does it need error? Okay, so the mind needs truth, it doesn't need error. So, truth, correct order, correct function. All right. So the truth puts the right things in the right order, and when the right things are in the right order, it works. Right? Error, it puts the wrong things or the wrong order, and that goes to dysfunction. Right? It results in dysfunction. So, when the mind is under the influence of error, it is going to result in dysfunction. It will initially result in dysfunction of thinking or thought processes, But since the mind is the major controller of the body, then don't be surprised that if the mind is under the influence of error, that the wrong order and the dysfunction might not also show up in the body, right? When the mind is feeding on or is taking in the truth, which puts things in the correct order and leads to correct function, now the mind can control the functions of the body the way that it's supposed to, and now it can work as long as these are working as well, right? Because you have to have both. You have to have both the physical needs that are supplied, but now you also have to have the needs of the mind that are supplied, which includes security and peace and love and hope and justice and acceptance and stimulation and mercy and so on. And there's a lot of other words that we can throw on there of the things that we need, right? Now, is the mind the source of the information that it needs? Is the mind the source of the information that it needs? Is the body the source of the chemicals that it needs? Okay, so if you're hungry, you can start eating a finger. And when that's gone, you can eat the next one. You know, it's like having hot dogs, a little more crunchy. You know, and you work your way down, and then you kind of satisfy your hunger. But you get hungry again, and then you have to work on some other fingers, and so on. Then you get hungry again, and maybe, well, I don't know, I'm not limber enough to start eating my toes, but I have to eat, you know, hand nubs and whatever. Is that going to work? No, of course not, right? It's ridiculous. So no, you don't need what you have, you need what you don't have, right? And it has to come from somewhere outside of you. And if it stays outside of you, well, then you die. And you can only live if it's brought in and it becomes a part of you, right? Well, it's the same thing with information. If the information stays outside of you, it can never either help you or harm you, depending on if it's truth or error. The truth can never help you if it's not brought in, and the error can never harm you if it's not brought in. It must be brought in order for you to be able to use it and function by it, right? So there must be first a taking. All right, so we will just take, right? There must be a taking. And so that bringing it in. But do you just take? All right, so if you eat food, but you don't go to the bathroom, is that a state of function or dysfunction? Dysfunction, right. If you drink water and you don't pee, and you water retain, that's a state of dysfunction, right? If you inhale, but you don't exhale, well, you're going to find that you're in a state of dysfunction, right? Nothing just takes. You must take and you must give, right? So there must be the taking and there must be the giving, right? This is a fundamental law of all nature. It's a fundamental law of all nature. Everything in nature functions by this simple principle that everything first takes and then it gives, right? Everything first takes and then it gives. There is no biological system that can function without the taking and the giving. There is no physical entity that does not take and give. It doesn't matter if you get down to subatomic particles or if you get to the size of galaxies. Everything in nature takes and gives. Right? Everything takes to give. And since everything takes to give, everything functions, we can look at it kind of this way, like a channel. Right? And that channel has an entrance and it has an exit. There is the taking at the entrance. There is the giving at the exit. And if you were to put in cause and effect, where would you put cause and where would you put effect? Cause is on the taking side and effect is on the giving side. Right? The law of cause and effect, which we're all familiar with because of the effects that come, the law of cause and effect is an effect of this fundamental law that everything must take to give. And therefore, everything functions like a channel with an entrance and an exit, the taking at the entrance, the giving at the exit, cause at the entrance, effect at the exit. Why do we need nutrition? Because the channel doesn't produce anything of itself. It can't be its own nutrition. It has to get it somewhere. And then it brings it in. It can, in a biological system, it will use it, and then it must pass it along. Right? In a non-biological system, the smaller you get, the less maybe using that there is, but at least in biological systems, there must be a using of it, and then you give it away. It's not only our biology that works this way. Our mind works this way as well. The mind must take, and it must give. It must take, and it must give. So there must be the taking of information, and there must be the giving of the information. Now, where does the mind give its information to? To the body. Yeah, it gives the information to the body. And now the body can express. And so you have facial expressions, and you have words, and you have actions, and other things of that nature that happen through the body, but it came from the mind because the mind served as a channel, right? Taking that information and now giving the information to the body. Relationships function according to this law as well. There must be a taking, and there must be a giving, right? There must be a taking, and there must be a giving, right? And there's so much. I have so much on this. All right. I'm not going to go farther down that pathway right now. I just want to introduce you to it because we're going to run down that pathway tomorrow. Right? We're going to run down that pathway tomorrow. Of all of these things, of exercise, oxygen, rest, temperature, or warmth, water, nutrition, mercy, stimulation, acceptance, justice, hope, love, peace, security. You know what our greatest need is? That's love. You will give up food for the sake of love. You'll give up water for the sake of love. You'll give up warmth for the sake of love. You'll give up rest for the sake of love. You'll give up exercise for the sake of love. You'll give up oxygen for the sake of love. You'll give up life for the sake of love. Right? It's the primary importance. Right? And when it comes to disease, what do you think might be the primary factor in disease? A deficiency of this. It's a deficiency in this, of love. Right? I'm not going to prove it now. I'm just going to tickle your minds with it tomorrow. We'll dive into that some more. Right? But it's our greatest need. And if we're deficient in it, it will have effects. It will have effects. And will it affect our lifestyle? Yes, it will. Absolutely. Will it enter into our nutrition? Yes, it will. Anybody went Anybody got under some relationship difficulties and in response to it just went crunching, munching, right? Yeah, it's usually not carrots and celery and broccoli. It's usually other things that go crunchy munchy at those times because they make us feel a certain way, right? You know, but if all you got is broccoli, you'll do broccoli, maybe, unless you hate broccoli, right? So yes, a lack of this has its impact upon our lifestyle. It has an impact upon our diet. It has an impact upon our sleep. It has an impact upon our cholesterol. It has a definite impact upon our stress. It can definitely relate to our high blood pressure. It definitely has an impact on our cardiovascular disease, even our gout, and it's a big factor. It really is a big factor, right? And it's important for us to recognize it and understand it, because if all we do in relation to disease is treat the physical manifestation with a physical intervention, I'm not saying we shouldn't, right, ever treat physical manifestations with physical interventions, but if that's all we do, then we miss out on something that is far deeper, that is far more important, that is far more transformative, and has the potential to affect not just the physical manifestations of disease wherever they might be, but something that has the potential of affecting not just disease, but affecting relationships, of affecting mental health, of affecting spiritual health, and so on, so that you can be holistically well. And that's where we're going tomorrow. But I have kept you long enough, I think. I don't have a watch or clock or whatever. I get to talk forever when I don't have a clock. My wife knows that I can talk forever when I don't have a clock. But I think it's probably time for me to cool down, for you to have some thinking time, and then for us to come back together again at 2 in the afternoon for our next session, and then we can dive in more. But yes, come on, Kim, and you can close us off. Mm-hmm.
Wow, that was amazing, wasn't it? Thank you so much. We've got a lot to look forward to tomorrow. So we'll be back here at 2 o'clock. At 5 o'clock, we'll actually hopefully have enough soup and buns. So we'll make soup and buns for you, and then there'll be a 6 o'clock session as well. And I know you'll really learn so much, gain so much, and with this information, be able to use it as well. So thank you so much, Mark. It's been great. So tonight, we have got, if you want to, you can stay for a hot herb tea. We've got herb teas. There might be some caro left. I can't remember now. But you're welcome to stay and chat if you want to, or you're welcome to go home as well, whichever way you want to go, so that you're back here or can be back here tomorrow. Mark also has our church service tomorrow, so anyone who's interested, we come along. It's on... that's right. I had that, but it went. Stewardship versus ownership. So it should be a wonderful message as well tomorrow. But otherwise, it's 2 o'clock tomorrow afternoon. So thank you all very much. I just wonder if you could close your eyes for a moment, and we'll just close with prayer. Dear Lord, thank you for the opportunity we've had tonight. Thank you for the amazing way that you created us. And we know that with our thinking, with our words, with our nutrition, with the way that we look after our bodies and our minds, we can make such a difference to our lives and our relationships and all around us. Thank you, and please, travelling mercies for everyone as they go home. In your blessed name, amen. Don't forget to invite anyone you want to as well. We'd love to see them.